Hi everyone. So today we are talking about hepatocellular adenoma. And as the name suggests, first is that it is a adenoma, that is, it is a benign neoplasm. Hepatocellular, that is arising from the hepatocytes, that is, it is arising in the liver. Now, before we go into the theory, first let's set up a story here because with the help of the story, it will be easier for us to derive theory from it, especially for exams. So, first story and then theory. So, the story goes like this. There is a construction site. So, there are construction workers here who are building something. And the construction site is in the shape of a liver. Now, these construction workers, they are building a wall which is just 1 to 2 wall thickness or brick thickness or cell thickness, just 1 to 2 levels of it. And they're closing the ducts and the portals. So that is, they're stopping the communication. So there is a construction site and they're building a wall which is just 1 to 2 brick thick, and they're closing the portals and the duct. Now, who is funding this project? This construction project is being funded by the hormone company. Why the hormone company? When I tell you about the theory, we'll decode everything. But for right now, just remember the story. There is a construction happening funded by the hormone project. And who all are into this project? There are 4 types of contractors, and all the 4 contractors specialize in something, and that is why they are different. So the first one is the Jack and Stat. So like Jack and Jill, so we have Jack and Stat as the contractor number 1. The contractor number 2 is H and F. Okay, Mr. H and Mr. F. The contractor number 3 are animals. There are 2 cats who are doing the construction, and the 4th one is also an animal, that is Hedgehog. Okay, now with this basic story lineup, let's go into the theory. So the first thing is that the adenoma, the currency required for the adenoma, that is the project, has to be funded by the hormones. Now what hormones exactly? The ossipils and the androgens and anabolic steroids, metabolic syndromes. So all these hormonal projects is the currency for this liver adenoma. Without this, the construction will not happen. So the funding has to come. Now let's go into the type of contractors. This is basically the different types of adenomas. But with the help of this outlining story of the contractors, we will be able to remember in detail about each adenoma. So as I said, the first one is the Jack and Stat. Like Jack and Jill, we have Jack and Stat. They do to their construction is that they decorate it with the help of blue and pink balls. So what is this blue and pink balls? These are the inflammatory cells, and that is why it is called as inflammatory adenoma. And this pink stain is the SAA stain. So clinically, this particular adenoma is associated with obesity. So we are drawing Stat as obese. So it is associated with obesity, and she likes the color pink. Therefore, we will see pink stain, SAA stain, positive in this. So what are Jack and Stat doing? They're decorating their project with the help of pink and blue balls as are inflammatory cells. That is inflammatory adenoma. There are 4 types of adenomas. This is type number 1. Now type number 2 is H and F. So we have Mr. H and Mr. F, and how are they decorating their wall? They are decorating their wall with the help of balloons. Now balloons goes to represent steatosis in the liver. So when we see adenoma with steatosis, we have to think about HNF1 alpha inactivated. But the problem with balloons is that they cannot last long. So after some time they will burst. So it will not look fabulous anymore. So there will be loss of LFAB. So in HNF1 alpha inactivated adenoma, there is loss of LFAB staining. So we can remember the story in this way to get to this point. So we have adenoma showing microvesicular steatosis. Think of HNF1 alpha inactivated. And this particular adenoma has low malignant potential, and it is often seen with women having ossipils. The third type is the 2 animals, that is cat. And from cat, we will remember β-catenin. Now, since this construction of this wall is taken place by animals, that is cat, they don't understand where to stop. And after a certain point, there will be a risk of falling. And this goes to say that risk of falling represents risk of malignancy. So the one with β-catenin will have the risk of malignancy. So this is β-catenin mutated hepatocellular adenoma. This is the third type. Now, Robbins has added the fourth type, that is hedgehog. Now we know this is the hedgehog animal, and we can see that there are spikes here, this thorny things, and if you touch there will be bleeding. So with this we will remember that this particular hepatocellular adenoma is most commonly associated with hemorrhage. Okay, and we know that this hedgehog, it doesn't walk on the floor, it glides. And from glides, we will remember GLI1 overexpression takes place in SHH activated adenoma. Okay, so to revise and summarize, we have a construction site where they are building a wall which is 1 to 2 brick thick, and they're using cement which goes to say the reticulin stain, and they are closing the ducts and the portals. The funding for this project is coming from the hormone projects, that is the OC pills, androgens, anabolic steroids, and metabolic syndrome. There are 4 types of contractors, which are the 4 types of hepatocellular adenoma. The first one is inflammatory adenoma, which is taken care by the JAK-STAT pathway, and they get pink and blue balls for decoration, that is the inflammatory cells. It is associated with obesity, and we see pink stain, that is SAA stain. The type 2 is HNF1 alpha mutated hepatocellular adenoma. Now these people, they get balloons for decoration, that is to say that there is steatosis. So an adenoma with a lot of steatosis, especially microvesicular steatosis, which does not look that fab, there is loss of LFAB staining. That is HNF1 alpha mutated hepatocellular adenoma. The type 3 is beta-catenin. Now since they are animals, they don't know where to stop, so they go on building. This increases the risk of falling and therefore the risk of malignancy. And the fourth type is the hedgehog, which is a new one.